delay because I don't even see Janet. That's so weird. Yep. Okay. Let's do it. All right. Oh. Yeah, let me turn this down here. All right. Of course, leave it to me to be late for my own Facebook Live Q&A. Parents, thank you for being here for the second day in a row. Let me turn this down here. All right, so we're back for a second day. Thanks again for joining us. My name is Tim Waller, and I work for Greenville County Schools. And today we have a very special guest to talk about questions that come up a whole lot about students in school during this COVID-19 stage. Janet Logge, who is our Medical Health Services Director. How are you?
I'm doing good.
Are you fired up? Are you ready to go for the new year?
I am ready. We are getting ready, working real hard to bring back our staff and students to school safely.
Yeah. And I want to tell folks, Janet, while we've got them here as they continue to funnel in the door here. So yesterday we had Jeff McCoy. He was our superintendent for academics. We also had Tracy Hogan, who was over special education. So what we're trying to do is gear the questions toward the specialties of these various experts that we have here. Janet is a wealth of information when it comes to all things medical around schools. How many school nurses are really kind of under your umbrella in your department?
Sure, we have about 130 nurses working in Greenville County School District, and that does not include our group of substitute nurses, but we're fortunate to be able to have a nurse in every school here in Greenville County, and we're very proud of that. And we're just working real hard to get ready to support our students at school and provide the services they need to be safe and healthy.
Is there, before we start, we have a bunch of parent-submitted questions, and there are good questions in there. Is there something you'd like to kind of say at the outset, that question that you hear all the time from parents, that one thing that keeps coming up all the time?
Well, there's one question that keeps coming up is what's going to be required regarding masks, and the answer is we wear masks to protect another person from our respiratory droplets. And so when we wear a mask, if someone else isn't wearing a mask, they're not protecting us. So we're asking that all our students who are able to wear a mask do so, and staff members as well, and that will decrease the spread of COVID-19. Which is spread primarily through respiratory droplets.
Yeah, and I think you would also tell parents who might be concerned about their child wearing a mask all day. The truth is, they won't wear it. They probably won't wear it at every single moment of the day, right?
No, sir, they won't. If students cannot properly social distance, which means they are 6 feet apart from one another in each direction, they are allowed to take their mask off, and we encourage them to take their mask off.
Sure.
So it's those times during the school day that they're wearing a mask is when they're transitioning in the hallway, they're getting up to go to the bathroom, they're walking by other students. We're really trying to prevent that, just minimize that risk of spreading germs to another student or staff member.
Yeah, I wish I had the ability to bring some visuals into this. I got to go to one of our elementary schools, A.J. Wittenberg, a couple of days ago, and they had a couple of classrooms set up. One had tables and the other had desks, and they were socially distanced. And I mean, your mind can imagine what that looks like, but it was really impressive, the space between the desks, and I think
Sure.
any parent would feel a whole lot better about that. But anyway, let's get down to some questions here. What metrics does DHEC use to determine community spread?
So there's three metrics that DHEC uses. The first one is the 2-week incidence rate. So over a span of 2 weeks, it's how many positive cases do we see here in Greenville County. The second metric is the trend in incidence rates. So what is the trend? Are we increasing, are we stabilizing, or are we decreasing in community spread in our positive cases? And the last metric that we use is the 2-week percent positive rate. And what that means is how many people are positive compared to how many people are tested.
And let me ask a follow-up question to that. When we rolled out our roadmap plan for what in-person attendance could look like, it was that continuum of possibilities, everything from 0 days attendance up to the full 5 days attendance, and then everything in between, 1 day, 2 day, and all that. A lot of parents felt when they looked at that chart that, good grief, we could be all over the place week after week. So as you're talking about community spread, is it safe to say that we're not seeing week to week these wild swings from one extreme to the other? I mean, it's pretty steady whether it's trending upward or downward. Is that a correct statement? That's
a correct statement. In fact, here in Greenville County, we haven't stabilized our trends. So we're not seeing decreases right now. We're just seeing increases. So it has been kind of a steady high levels across the board in Greenville County. So we're not seeing fluctuations like this. So I don't imagine we're going to go from 0 to 5 from week to week.
Yeah, no. Okay, are we using statewide data, or is this county data?
Sure, that's a great question. In fact, I recently contacted DHEC, South Carolina DHEC, upstate DHEC, to inquire about just this question. And yes, indeed, we are using Greenville County data to interpret our numbers of positives. So the numbers that Greenville County School District is working from are Greenville County specific data.
Yeah, so what's happening in Charleston County, Dorchester County, Horry County, that's not factoring in
that is not
to these
factoring
metrics.
In. That's exactly correct.
All right. Here's another question. What are the numbers or percentages indicating highs and lows?
Another good question. I don't have that exact data right here at my fingertips, but that can be found on the DHEC website pretty easily. If you put in the search bar schools, it should come up the list of links you can go to find that information.
And all of their data is pretty much real time. I mean, it's updated constantly.
It is, and in fact, that such data is updated weekly. In fact, on Monday evenings, it's usually updated.
Okay, good. Here's a great question. If a vaccine is discovered, will it be mandatory to return to school, like I guess with all other vaccines?
Sure. The state of South Carolina actually mandates our vaccine requirements for school entry. So we would, defer to the state of South Carolina to see if that would indeed be a required vaccine.
I have a question, a little in-between question before we go on to the next question from parents. How often is the communication, Janet, with your team and people with DHEC? I mean, it's pretty regular. Correct.
Oh, sure. Yes, absolutely. We have a great partnership with DHEC, and I have one of the DHEC epidemiologists on my speed dial, I say.
Right.
So I'm frequently in contact with them with any question that comes up to, verify and to, understand what's going on here in Greenville County.
Yeah, it's not like people are sitting around doing a lot of guesswork. I mean, you're getting real-time information from these folks.
Yes, absolutely.
Great. All right, here's one. Will bus drivers take temperatures?
No, we are not going to ask our bus drivers to take temperatures of students. We are asking parents to monitor symptoms and temperatures at home prior to getting on the bus and coming into school.
Okay, good. Here's another one. Will the temperature of students be taken at school?
So no, we are not going to take student temperatures at school. Again, we're going to rely on parents to monitor those symptoms at home, and certainly if a student presents ill or with any symptoms of illness, they will be assessed by the school nurse, and follow the guidelines that are
Sure.
set forth for students in the school setting presenting with fever or other symptoms. I will tell you that also research tells us that children are unlikely to present with fever as one of their first symptoms with COVID-19. So that factored into our decision not to take temperatures of students in the school setting.
Okay. And there's been a lot of talk about that subject as well, with children and COVID-19. So that's good to know. Okay. If a student has a doctor's note excusing mask wearing, will this be honored in Greenville County schools?
Yes, it will. If the student's healthcare provider, a licensed healthcare provider, has written a note documenting the medical condition preventing the student from wearing the mask, that will be honored at the school level.
Okay. Good. What happens if a student misplaces a mask during, transition or movement, or just forgets to bring their mask to school?
Well, sure. We're anticipating that. That happens. They're kids. We are going to do our best to remind them to bring their mask or not lose their mask, but a substitute mask will be provided to students who forget or lose their mask during the school day.
Okay. Let me interject. Okay, I have another question, and this is based on a conversation I had with a young mother yesterday, and I thought it was just a very good question.
Sure.
Kids. We all know kids. They wake up one morning, they have a little cough, a little sniffles, their stomach is upset, they might have be running a fever, and that could be due to a lot of factors. So how does that jive with the safety protocols that we want people to take in this COVID-19 age? What should a parent do?
Well, I know that we have a list of symptoms that Dhec has listed for us that are very prominently seen with COVID-19. And then there's some very obscure ones that you might see in children, like diarrhea and vomiting, that might not be seen in adults. So we ask parents to keep students home when they're sick, just to practice an abundance of caution. And if they have a fever, if they have the sniffles, to keep them home, contact their healthcare provider, talk it over with them, call the school nurse, talk it over with them, and send the student back to school when they're healthy. And
just to follow up on that, I think students get 10 days of absences, and this was the other concern. And I've heard that that's being loosened a little bit, at least to the point of understanding with parents who have a sick child, and now COVID-19, where we err on the side of caution.
Sure.
You would tell parents that don't worry so much about your 10-day absence limit and worry more about keeping everybody safe?
Yes, I would do that, but I would encourage communication with your school, communication with the teacher, the school nurse, your principal. Talk it over, make sure that there's a real good communication back and forth going with that.
Sure, and that's always the best policy, right? I mean, let people know what's going on in your house. All right.
Sure.
By the way, I want to mention, and I meant to do this at the beginning of all this, we actually brought out a tape measure in the beginning of this. You came in here, Janet, with your mask on. I have my mask off to the side in the wings. We are seated 6 feet apart, in case you're wondering. And yes, it's true that a lot of us here at the district office work together often, but we still practice all of the social distancing, the mask wearing as we move about in the district office. So I meant to mention that a little bit earlier. That's why we're so far apart right here.
That's right.
We actually do like each other. We're all good coworkers here. So, all right. Let's talk about masks. I use those little cheap, disposable, medical, that type there. What about those bandana kind of masks. Are those okay for students to wear?
Sure. We are asking students not to wear bandanas. We are requiring masks that cover the nose and mouth, cover underneath the chin, and don't allow for any gaps. If you're wearing a bandana, it's very loose down at the bottom, and that could increase the spread of germs, increase respiratory droplets getting through.
Yeah, okay. Yeah. All right, that's a good one. What happens if a student consistently does not wear a mask?
Well, we have addressed this, and we are going to give our students every opportunity to learn how to wear a mask, learn why we're wearing the mask, but ultimately, if after all our efforts are exhausted, there is a discipline code that schools will follow for refusal to wear a mask.
Sure.
Yes.
So you have to wear a mask when masks are required during the school day.
That's
this
right.
is not optional.
Whenever social distancing cannot be maintained, we need staff and students to put their mask on.
Okay. Now you held up the one type of mask that I'm very familiar with a minute ago, but let's talk about other kinds of masks. So bandanas, not something we want to see. What about other types? The N95 cloth or disposable?
Well, N95s are specialized masks that are reserved for healthcare providers. And as everyone knows, I'm sure, watching the news,
right,
there's a shortage of those, and so we really do want to reserve those for our healthcare providers. Disposable masks are very much like this one here. Those are acceptable. Again, those are disposable. They're not as durable as, say, a cloth mask would be. A cloth mask can be made from any tightly woven material. I would say a knitted mask, unless they have a layer underneath, is not a good type of mask because it has holes in it and can let things penetrate.
Sure.
We have those gaiters or buffs that I think are commonly used by kids in sports and people that play sports. They're kind of a neck scarf, if you will, and you pull it up over your mouth.
Yeah.
Those would really hit the requirement because they cover the nose, mouth, and they are tight along the sides of the face and underneath the chin.
Well, I can totally see maybe older students, being able to wear a mask at various times, often throughout the day. But now, do the youngest students? We're talking, everything from 4K to kindergarten, first. Do they have to follow the same mask policy?
Sure. Well, we recognize it's extremely difficult for very young children to wear a mask, keep a mask on, understand why they're wearing the mask. Children have a habit of touching their mouth almost constantly, and it's almost the opposite of what we want.
Right.
We don't want you touching the mask because that could increase the spread of germs. So we're not requiring our students in preschool up to first grade to wear a mask.
Oh, okay.
They will be allowed to wear a mask if they choose to wear a mask, and that will definitely be supported in the school setting. But students age grades 2nd through 12th grade are expected to wear a mask.
Okay.
Some special ed students are also exempted from wearing a mask due to special needs.
So, just to repeat what you said, preschool to first grade, they don't have to wear a mask.
That's right.
At really any time or all hours of the day?
They are not required to wear a mask while at school.
While
or on the
at
bus.
school. And then 2 through all the way through 12. They have to follow the mask policy.
The expectations is they would wear a mask when they're not social distancing.
Okay, good. What about low-income families that can't afford masks?
Yes, Greenville County Schools will provide masks to students who have low, they have the meal free and reduced.
The free and reduced, sure.
Free and reduced meal program. We will provide masks to those students.
Okay.
That's correct.
So if they're on that program, already signed up and approved and everything, that we will provide masks to them.
That's
okay.
right. Yes.
Good. Here's one. Will masks be, will students be required to wear masks at recess? I mean, come on, they're outside.
Yes. So students will be required to wear masks outside if they cannot properly social distance. So again, that's going to be, a lot of work on our wonderful teachers' plates to socially distance while we're outside.
Yeah.
There's different games, there's different activities that students can engage in, and that will keep them 6 feet apart.
Sure. Okay. Do they have to wear masks at all times or only in hallways or high traffic areas? And I think you've kind of touched on that.
Sure.
When social distancing is not possible.
That's right. So if they were transitioning from a classroom to the cafeteria or the classroom to get to the bus or dismissal home, we would ask they have their masks on in case they walk by one another or walk by a group of other students maybe coming down the other side of the hallway, just as a precaution.
Okay. You mentioned a couple of good practices a while ago about what a mask should cover on a person's face, but will there be guidelines on how exactly masks should be worn? Let me put it a different way. If someone's doing it wrong, will someone tell them what the proper way?
Sure, absolutely. We will provide information at the beginning of the year for all students on the proper way to wear a mask. We'll provide that for the staff as well.
Yeah.
And then throughout the day, every day, those reminders will occur in the classroom, and the nurse can help assist with that as well.
Sure. And not to overstate what we're talking about here, but like I noticed with the disposable masks on me, maybe because I have a long face or something, it always slips down below the nose.
Sure.
And I've seen that happen with other people too.
Sure.
So you're constantly raising it up. So will teachers remind students who are sitting there and their nose is sticking out or whatever, put your mask up?
Yes, the expectation is that teachers will remind students. There will be signage throughout the school, reminding staff and students about proper way to wear a mask, when to wear the mask, when to socially distance, reminders for hand washing and using hand sanitizer and all those sorts of things.
Sure. All right. If someone is taking a medical exemption from a mask, wouldn't that automatically be a virtual learner?
Well, no. We are allowing for students to provide a documentation from a licensed healthcare provider stating they have a medical condition that prohibits them from wearing a mask at school. So we would then honor that and wouldn't require them to wear a mask, although we would take special precautions and make sure that social distancing is followed.
Right. I want to mention one thing before we go on, just to give parents a little heads up. And this gives you a chance to, because you've been answering rapid fire questions, it allows you to take a breath and catch your breath. But in about, 8 minutes from now, 7 minutes, we're going to talk to Adam James, who is our transportation director. He's actually off in the wings right now. So as we talk about school buses and how many students are going to be on a bus and how we're going to do this when there's in-person school, where will they sit, how will they sit with social distancing, all that stuff that a lot of you have been asking. Here's your chance. This is the guy who's over the fleet, and he's been a part of these conversations from the start.
Sure.
And it's a huge undertaking too. So thank goodness for people like Adam James to handle it. So we're looking for you, Adam. Okay, so we have a few minutes left. Janet, let's get back to a question. Is there a specific form for the doctor to fill out to confirm that a child cannot wear a mask?
No, sir, there's not. We just require that there's a note from the medical provider stating the medical condition and the reasons why the student should not be wearing a mask at school.
Okay. Medically, would wearing a mask all day bring about a lack of oxygen with children? I've heard a lot of people make that argument.
Sure, and I've heard that as well. I think that's an excellent question. In fact, the research does not support children developing any sort of respiratory condition when wearing a mask. Does not increase any problems in breathing, doesn't have any long-term effects on them from the research that has been done. Certainly students with asthma and underlying respiratory conditions perhaps might have difficulty wearing a mask, and that's where that exemption from the medical provider comes in. If the parents can bring that, and that certainly would be supported in the school setting.
So asthmatic children are really a good solid example of someone who might need that exemption, maybe, depending.
Yes, there's some students with asthma that are very well controlled on their medication, and they have inhalers at school to help support them if they're having any problems. So that doesn't rule out all students with asthma. Doctors might think their patients might be fine wearing a mask. We're going to leave that up to the medical providers.
Okay. You talked a little bit a while ago about N95 masks. Those are those big face shields that are hard to get because they're in short supply. Medical professionals need one. However, is that if a parent can find them, is that a good option for children who, for whatever reason, can't breathe under a regular mask?
Well, the N95 is actually a fitted mask that goes over the nose and mouth. I think you might be referring to a face shield.
I am. So I blew that one. So yeah, okay, so the fitted thing. All right.
Yeah, that's an N95 for the healthcare providers. But the face shield that many parents and staff members alike have inquired about wearing in the school setting. I can tell you that the face shield can provide some protection, but it cannot provide as much protection as a mask that covers the nose and mouth and has no gaps in it. So students can wear face shields, but they need to have a mask on underneath, a proper fitting mask on underneath.
Oh, okay. Okay, that makes sense. What about parents who don't want their kids to wear a mask? We hear that all the time. And will they still be able to come to school and take part in class with the other students if masks are mandatory? But you know what? Parents, they just don't want their kids to wear them. What's the policy on that, Janet?
Well, again, if a student we're honoring students that have medical conditions preventing them from wearing a mask. There's lots of ways you can work with your student at home, practicing wearing a mask, explaining why we need to wear a mask to prevent sharing our germs with other people. I think that's very important. I think children take our lead. I think they sense that things are okay when we tell them things are okay, and we're certainly going to have that perspective with our students at school.
Sure.
So I would encourage parents to talk to their healthcare providers if they have concerns about sending their students to school wearing a mask, but know that there will be breaks from the mask. When the students see it seated in their desk and they're 6 feet apart, they can take those masks off and be able to be without the mask for a period of time.
Okay, good. All right, here's another question from a parent. When students are allowed to go for 5 days, will masks be required despite the the spread of the COVID-19?
Another good question. That is something that we'll have to determine at the time. We're going to take all the information that we learn from now until we go 5 days, and from Dhec and CDC and medical providers and all the research that has been done on COVID-19, and I think that we make that decision at that time.
Sure. Will students be able to wash their hands when they want, or will they be asked to do so when they're entering the classroom?
So there'll be time set up throughout the school day for students to wash their hands before meals, after recess, after going to the bathroom, certainly. And if there's occasion where the hands are soiled and they need to be cleaned, I'm sure that the classroom would accommodate that. There will also be hand sanitizer available throughout the school for use by by students.
Sure, and I saw that too at one of the elementaries the other day. They're getting that all set up. That's a lot of hand sanitizer.
Yes, indeed.
But we have a lot of kids in a lot of schools. Is it possible, really only in elementary schools, for a classroom of students to be considered a cohort, meaning they spend a lot of time with each other, maybe siblings, maybe friends or whatever, and therefore, let me see the last part of that question, and therefore they don't need to wear a mask at all?
So certainly all angles have been considered with mask wearing, and I think students, it's important that they do wear a mask even if they are in a cohort, even if they are traveling with their single group of 10 to 15 students in a classroom. It's important that they wear masks to decrease the spread of the virus. As we all know, this can be a unique thing about COVID-19 is that it is asymptomatic. It can be asymptomatic, where you do not express any of the symptoms, and it's unknown whether you have it. So we really need to be very, very cautious and proceed as if we have the virus, and then we're protecting other people by wearing it. If we come within 6 feet of one another, we really need to have that mask on to protect one another.
And we have time for one more question, and it kind of segues out of what you were just talking about.
Okay.
This is a great question. What will be the policy for identifying students with fever or other symptoms?
Sure. We often rely on teachers, and teachers are very astute on recognizing when their student does not feel well. Certainly we'll ask the students, how are you feeling today? And the teachers in the classroom will gauge very quickly if their student is not feeling well. And at that point, the nurse will be called and be able to assess that student and provide any follow-up care that student should need. If we do have a student in the school setting that has symptoms of COVID-19, a fever, a cough, shortness of breath, loss of taste or smell, we will isolate that student away from other students and staff, call parent right away. Also, remember that when we say isolate, we mean separate them from their group of peers and from other employees, but they will be monitored and supervised at all times.
Okay. Sounds like you're ready to go.
Yes, sir. We're getting there.
We'll find out soon enough, huh?
That's right, yeah.
Well, Janet, thank you for coming in and taking 30 minutes out of your already busy day. And good luck.
Thank
in
you.
the coming year. Now, I want to make a big show of this. As you leave, and Janet, we're going to have you go out this way. You will take off your microphone, and if you don't mind, let's do a little disinfectant on that, because whoa, hello. And that's just me. Okay. Because then Adam James, our transportation director, is going to come in, and you answered a lot of questions, which is going to help me now, because parents are asking a lot of those same questions, and I can, hopefully, if I can remember the bulk of what you said, communicate that to them. So anyway, thank you.
It was a pleasure to be here. Thank you.
Yeah, thanks. Appreciate it. All right. Come on in, Adam. How are you, sir?
I am good. How are you?
Good, good.
We're going to click this on my...
Yeah, just up there, anywhere near the mouth to capture your vocal cords. We'll as long as they can hear you. I like your mask, by the way.
Thank you. Thank you. Special order. One of our safety trainers.
Sure. No.
My wife makes those.
Oh, really?
Yeah.
Well, nice. Well, people have taken masks to a whole new level in the last few months. I mean, kind of a unfortunate result of where we're at, but hey, creativity goes on.
Yeah, there you go.
You're the transportation director for Greenville County Schools. When I think about what teachers are going to be faced with, to me, it's very daunting. But then when I think about our massive transportation system and operating with social distancing. I mean, and I asked the Janet the same thing. Before we even start taking questions, is there anything just right off the bat that you would want to say to parents about how in the world we're going to manage this? Because I'll bet you've been asked a lot of questions by parents. Where would you jump in on this?
Well, I would jump in by saying we're going to follow DHEC's guidelines. Right now, the current guidelines from Dhec is 50% of the bus capacity. What I've been telling people is realistically 50% is what that's going to look like is one child per seat unless they're siblings or from the same household. Then they're allowed to be 2 per seat, 3 per seat. 3 per seat should not happen at all. So it's going to be max 2 per seat. We are going to keep the seat behind the driver clear and the seat adjacent to it. So basically the first row of the bus will be clear. Children are going to load the bus from back to front.
Oh, okay.
So that way the bus fills up from back to front, so you don't have children walking by other children, potentially
right.
Exposing them to any germs or whatnot. There's going to be assigned seats based on the routing. We get a lot of questions about the assigned seats, and the assigned seats are really to mitigate risk. So basically, if Tim and Adam are in a bus seat and Tim has COVID, I'm able to notify, hey, this child around your child, tested positive for COVID. You're going to need to, take care of your end that way.
Wow, this is the first time I've heard about the assigned seats, and that is a great idea. Just like loading from the back, going forward. And a couple of days ago, I saw you at A.J. Wittenberg Elementary. We had a little event for reporters to see what socially distanced classrooms looked like. Adam, you were there with a bus so they could observe that. And so I got up on the bus, and it was really cool the way you had, what is that, painter's tape?
It's painter's
Just
tape,
kind of easy to remove painter's tape. Even though I don't have a visual to show in this Facebook Live, I saw, like, for example, a seat with 2 X's on the seat with painter's tape. A brother and a sister, 2 cohorts.
Right. So on those particular days, the X would mark where a student could sit.
Okay.
And some of those seats were designed to mark cohorts, if you will. It doesn't quite go to every other seat being up to 2 allowed, but it's almost every other seat, allowing two students per seat.
Yeah, interesting. And there'll be when you talk about assigned seats, when will they know? When will kids get their assignment on the seats?
Well, the kids are going to get their assignment, within the first couple of days of school, because the assignment's going to be based off of routing. So basically, the first child on the bus is going to go to the back of the bus.
Okay.
And then as the bus fills up, it will fill up back to front.
Okay.
So it's basically based off routing. Most, but not all, afternoon routes are the exact opposite. If whoever lives the closest is the first one off the bus.
Right.
So that is not always the case, but mostly the case. So that's basically what we're going to do.
Okay. Well, let's go ahead and take a couple of questions from parents. Will routes be extended based off of a 50% capacity?
Well, I may need a little clarification on what they mean by extended. Distance-wise, no. Time-wise, maybe. Yet to be seen. We're still in the process of routing. We encourage you, even though the deadline has passed, to guarantee for Labor Day for the transportation form. To guarantee for the first day. We still encourage you to submit that transportation form. If we can get to it in the routing process before the first day of school, we're going to do that.
Right.
So highly encourage that, especially so we can understand what our capacities are going to look like. DHEC has a recommendation of 50% capacity.
Okay.
The mode of our buses is a 72% capacity. I mean, we have most of our buses are 72 person capacity.
Okay.
Some are in the 30s, some are 78. But we're basing ours off the average. So 50% right there automatically goes to 36. There is a potential, if the bus fills up to 36 people, that we're going to have to, halt the route midway and, go drop those kids at school and then come back and resume the routes. That is a possibility.
Okay.
But with the 25% attendance or the 50% attendance, hopefully we're going to be in the ballpark of that capacity just based off what's allowed in school.
So, and I don't want to complicate this at all, but let's talk it through real quick. So, when parents look at that flexible in-person schedule, really the range of possibilities of what could happen. Okay, 0 days attendance. Well, we're not worried about buses because kids are home e-learning.
Right.
5 days of attendance. Well, that's what we're set up for, and you can, or can you? If kids go on a 5-day in-person schedule, now what does that do to the passenger load, if you will?
Well, that is going to be based off what the district determines based off of social distancing for the 5-day.
Okay.
If we go regular 5-day traditional like we're used to, then
Yeah.
social distancing could be not a worry.
Yeah.
If we still have to do it, then obviously it would automatically, based off simple math, double every single run.
Wow. Okay. I thought you might say something like that. That's why I wanted to ask.
Yeah.
So then, two more options here. So on a day where students might go to school for, say, 1 day, that would be, if you do the math, that's 25% of the students. That sounds like it's doable, pretty doable, right, for a school bus?
Yeah, it's pretty doable. I mean, I don't believe that every single school bus is automatically going to be divided by 25% based off
Exactly.
of the last name. But we hope to be in the ballpark, and we'll adjust on the fly if needed. I mean, we adjust on the fly every day in transportation.
Yeah.
That's, as I told the managers and supervisors yesterday, we had a lot of practice for a pandemic already.
That's true.
Because we adjust on the fly every single day. You have to when you already have a driver shortage and drivers get sick or drivers' children get sick or their grandchildren and they have to stay home and take care of them. We adjust on the fly every day.
Yeah.
And we make do.
That sounds good. All right, let's grab a question. Megan has written this in. Will children need to wear masks on the school bus? And what about the drivers? Are they going to have to wear a mask?
Yes, everyone is going to be required to wear a mask on a school bus. Like Janet said, unless they have a medical reason and a documented medical reason, the driver and the students will be wearing a mask.
And now in the school setting, because they have the desks all separated by 6 feet and everything, there could be times during class where they can lower their mask, but on a bus, they're going to keep them on?
They're going to keep them on.
Okay.
We cannot guarantee 6 foot on the bus.
That makes sense.
Based off the 50% capacity. It's near impossible.
Okay.
Maybe the first kid will get a break after they walk past the driver and sit down.
Right. No, that makes sense. All right. How often will buses be cleaned and disinfected?
Okay, so that's kind of a two-part question.
All
so let me give you some basic transportation terms. When we make what we call a run, meaning I pick up a load of elementary school students, I drop them off at the elementary school. That's a run.
Okay.
When I do that elementary, middle, and high, that's a route.
Okay.
So we have 369 routes. We have over 1,100 runs.
Wow.
So actually it's 371. We're expanding by 2 this year.
Okay.
So after each run, meaning after I pick up each load of children, the drivers are going to have to wipe down the high touch areas, the handrail, the backs of seats, anywhere where a kid is likely to touch. Most kids are going to touch the back of the seats just navigating down the aisle. It's just what happens. So those are going to be disinfected after every run. And then when the bus returns to the bus center at the end of the morning route, after they've run all 3 grade level or all 3 school levels, they're going to spray disinfect the bus at that point. And then that exact same procedure is going to be repeated in the afternoon. So they will be wiped down after each load is dropped off, to put it in everyday terms. And then after the bus returns in the morning and afternoon, they will be disinfected twice daily.
Wow. So at the start of every new day, a sparkling clean bus. That sounds good.
That's the idea.
All right.
I'm not crying about that.
All right then. Will virtual students be able to get transportation, say, to the career centers or the fine arts center?
The answer to that is yes. However, it's going to be, for the virtual students, it's going to be their responsibility or the parents' responsibility to get them to the high school for the high school shuttle that would normally go from the high school to one of those centers.
Oh,
So
okay.
we cannot do door-to-door from home to the Career Center or home to Fine Arts. We already did that with some of the homeschool students or some of the students that might have taken 1 or 2 classes within, the walls of Greenville County Schools. We've already done that, so we're able to offer that for the virtual kids too.
Oh, wow, great. And parents who are, or students who are going to be affected by this, if they don't already know that, they'll be notified, correct,
Right.
of where to go?
The high schools are going to notify them of that. And, and I think some of the middle schoolers go to Fine Arts. I'm not exactly sure.
Okay, good. Nancy has a question. What do we do if our child needs transportation from the Fine Arts Center after their morning class?
So again, we for those students that have Fine Arts, the very first class in the morning, we don't offer transportation to the Fine Arts Center.
Okay.
We do offer it from the Fine Arts Center, but that would again go back to the high school.
Right.
So if they're a virtual student, they're going to need to get transportation from the high school to their home. But we will provide them in a shuttle just like we would the in-person students.
Right, okay. Debbie has a question. How will special needs buses load and seat students?
Well, with special needs students, it's a little different ball game. We're going to try our best to, load them back to front. Some of the special needs students' needs require a little bit different seating arrangements, and we're just going to handle those on a case-by-case basis. I mean, there's a lot of reasons why they may need alternate seating or an alternate pattern than the others, and I think that would be impossible to address here. But we're going to address it on a case-by-case basis. I'm confident in our special needs department. I think our special needs transportation is above and beyond. I really do, and we have a rigorous program and a rigorous training program for the drivers and the bus aides. So I'm confident that we're going to be able to carry that out. And again, when just as in any other situation with a special needs child, if they have concerns,
Right.
bring it up to the school administration, bring it up to the supervisor of that particular bus area, and we're going to do our best to handle it.
Absolutely. Communication is always the key,
Yes, sir.
no matter what we're talking about here. So, and I hope I'm pronouncing her name right, Grecia. And forgive me if I didn't, Grecia. What happens if a student does not have a mask at a bus stop?
Well, at a bus stop, there's little that I can do there.
Right.
South Carolina law does state that the safety of a child at a bus stop is the parent's responsibility.
Oh, okay.
I don't know if the question means, what if there's a bunch of kids at the bus stop and one child doesn't have a mask, or does it mean if we pick up a child and they don't have a mask? If we pick up a child and they don't have a mask, the driver's going to give them a disposable mask. The drivers are going to have those.
So if they're pulling up and they look down, there's the bus stop, bunch of kids, and one of the kids doesn't have a mask, or a couple of them don't, they will be given a mask.
Yes, sir.
If they don't have one.
Yes, sir.
Or maybe reminded, if they have a mask, put your mask on.
Right.
Okay, yeah, that makes sense. Rachel, here's the question of the day. Will there be any field trips?
Again, that's right now. I think the district is saying, there's no field trips until further notice. Transportation loves field trips. When we go to band competitions or cheerleading competitions or whatever, the driver is on the clock the entire time. So transportation loves field trips.
Right. But what about virtual field trips?
Well, they are going to have virtual field trips.
Oh, okay.
I know the district is encouraging teachers to do virtual field trips whenever it supports their curriculum.
Yeah.
That doesn't involve transportation, unless they want us to film something about the bus, which we'd be glad to do.
That'd be a great idea. Why not, right?
Yeah.
Okay, good. Wow. Thank you, Lisa, for reminding me of this. Let's talk about the job fair. And we have these about every month, but the last, I think we did one last month, and so that one and the one coming up is really geared around transportation. You're still looking
Yes, sir.
for some good people who could become bus drivers.
We are.
So talk about that.
Well, we are in a driver shortage. That's not a problem only in Greenville County Schools. That's a nationwide problem.
Yeah.
So we are looking for drivers. I think we offer some pretty great benefits. We have some, talking to some mechanics, because I also oversee the activity bus shop. Some of the mechanics that we hear on the outside are saying, they're willing to take the pay offered just to get the benefits. So I think we offer some pretty good benefits in Greenville County Schools. It goes without saying, if you want to drive a bus, you got to like kids.
Sure.
You got to be patient. So that goes without saying. But a lot of people fear driving a 36 to 40 foot vehicle. And I always try to tell people, if you're a decent driver of a car, you're going to be a decent driver of a bus. I kind of alluded to this earlier.
Right.
We have a very robust training program. We actually do the behind the wheel test in Greenville County Schools facilities. We have
Oh, wow. Okay.
all of our trainers are certified third-party testers. A couple of our supervisors that supervise the bus areas are third-party testers. I'm extremely confident in our training department. I guarantee you, we can take a person that that has less than 4 points off their license. I guarantee you, we can.
Wow.
We can get them to be a bus driver.
As you sit there and talk about it, I was sitting here trying to wrap my mind around the idea of me driving a bus. I was thinking, could I really? Those are big old vehicles, but
You can do it.
yeah. And is there you talked about it, patient type, you got to like kids, that's first and foremost. Is there a quality of a person that you like to see? Who makes a good fit for you?
Well, I think a good fit for a bus driver is a patient person, an open-minded person.
Yeah.
I tell bus drivers, that every route has one kid. Every route's had one. It's not that some routes are worse than others.
Yeah.
Every route's got one of those kids, and but a lot of it's communication.
Sure.
I'm reminded of a young man that the bus driver had problems with. Or the young man had problems with the bus driver, whichever way you want to look at it.
Right.
And he found ways to work at it. And the bus driver went, and he told me this. I actually started driving this route for about 2 weeks. And he told me the trick, with this kid. And I tried it and never had a problem, kid.
Oh, wow.
And then the follow-on bus driver behind me never had a problem with that kid. A lot of it is about communication. If you're desirous of a flexible schedule, I think being a bus driver is great for you.
Yeah.
You are free between morning and afternoon routes.
True.
If you choose to be. If you want work in between, we can find that too. But if we have, he's since retired. The second time he's retired from bus driver, we had a gentleman that he played 9 holes of golf in between his morning and afternoon route every single day. Now he's fully retired.
Yeah.
I still keep up with him on social media, but that's what he loved to do. We have several small business owners that want to work. They work full time as a bus driver for the benefits.
Sure. Yeah.
We have several retired folks. You can apply for a bus driver on the website. You can come to a job fair. You can go to one of the bus centers and they will help you apply. Or you can call 355-1826 or 355-1289. And we'll walk you through the process.
Oh, wow.
If you need to come do it in person, we'll do that. If you need some help walking through it over the phone while you're filling it out online, we'll help you do that too.
And I don't know if you remember, roughly how many bus drivers would you like to hire? And you're also looking for driver's aides, correct?
Right.
Yeah.
So, when we did that interview with the media a couple of weeks ago, we said 66 at the time. We had several people come to that job fair. I was very pleased with the turnout at that job fair. We have 7 people in class this week from that job fair. So I think right now, it's hard to say without them being all the way through the training. So I think we still need at least 50 bus drivers. But that 50 also includes an overage. A certain percent of an overage. That way, if a driver does call out sick or something like that, we have somebody waiting in the wings to jump on that route. So we're not 50 route drivers short, that 50 does include an overage.
Sure. And I don't know, do you remember the date on the upcoming job fair?
I do. It's July 28th from 9 to 1 at J. Harley Bonds Career Center in Greer.
Yep. Know where that is. So come one, come all if you want to be a bus driver.
Come one, come all. We'll do a license check right there. If your license needs a little repair, we'll show you how to get some repair to it, or we'll politely encourage you to be a bus aide. But we'll do a license check right there. We'll do the application right there. We'll do the background check right there. Okay. I encourage. I think the job fair is the best, because you have probably 6 or 7 people in the computer lab helping you through that application process. You certainly don't have to come to the job fair. You can fill it out online. It's on our website. I believe it's the top right corner of the website where it says employment, and you can fairly easily navigate to the bus driver positions from there. But yeah, come on out.
Sounds like you're good to go for this coming year, or you'll find out soon enough, huh?
Well, there's a lot of work going on behind the scenes. We're still routing buses. That's taken. We have 12 areas. There's 12 supervisors routing buses. They have several people that work in the office with them that are actively routing buses. Mm-hmm. So there's a lot of when you transport 27,000 kids. That's a lot of behind the scenes work.
That's a big number. Adam James, Transportation Director, thank you for coming in here to talk about this. I want to mention. Tomorrow we have Scott Carlin, who's basically over our building facilities, and really his specialty is going to be talk about a little bit what you mentioned, Adam, and that is the disinfecting of schools, wiping down all touch areas and surfaces, and keeping ventilation going, fresh air going through the ventilation systems. He's a wealth of knowledge, and he's going to talk about stuff that I haven't even dreamed of, but it all makes sense in this COVID-19 age. So that's tomorrow, Thursday, at 2 p.m. We'll be right back here to answer questions about that. And by the way, even when this is over, which is about, we're going to end the live part of it, this posts on the Greenville County Schools Facebook page. So if you caught us at the very end and you want to hear more about what Adam said, or Janet Loggy, our Medical Health Services Director, just go back, scroll back and watch it from the start. But thank you for submitting all kinds of great questions, and we'll see you here at 2 p.m. on Thursday. All right, see you later.